Welcome to the Phytotherapy Desk Reference YouTube channel, where we explore all things herbal medicine. In today's episode, we will review an excellent study on the use of berberine in the treatment of polycystic ovarian syndrome. This is a very well designed and executed study with clear implications for clinical practice. Let's dive into the details of this study. PCOS is the most common endocrine disease in women of reproductive age. It is the main cause of infertility due to an-ovulation. PCOS is also a significant contributor to the development of early onset type 2 diabetes, anxiety, and depression. This image shows a normal ovary on the left and a polycystic ovary on the right. The normal ovary is small in size, has few randomly distributed follicles of varying sizes interspersed within the stroma. The ovarian stroma holds immune cells, blood vessels, nerves, and lymphatic vessels, as well as other ovary-specific cells and components. In contrast, in a typical polycystic ovary, both the length and width are increased, as well as the total ovarian area. It contains numerous follicles. According to the Rotterdam criteria of 2018, 2 out of 3 features must be present for the diagnosis of PCOS: menstrual disturbance, excess androgens, and multifollicular ovaries. The clinical features of PCOS can be classified into 4 categories: reproductive, dermatological, metabolic, and psychological. The major disorders associated with PCOS are menstrual irregularity, an-ovulation, and infertility, acne and hirsutism, metabolic syndrome, insulin resistance, diabetes, and dyslipidemia, and also depression, anxiety, and other mental health disorders. PCOS is dominated by the excessive presence of the male sex hormones. The main source of excess androgens is ovarian hypersecretion. The hypothalamus secretes gonadotropin-releasing hormone, which stimulates the ovarian's thicker cells to produce androgen. The anti-Müllerian hormone is 2 to 3 times the normal level. This hormonal mix inhibits follicular maturation, resulting in numerous small follicles and general disturbance of the ovarian structure. Current treatment options for PCOS include physical exercise, hypercaloric diet, birth control pill, androgen antagonists, also known as testosterone blockers, and metformin. I have also done a comprehensive review of herbal medicines for PCOS, which is available via the Phytotherapy Desk Reference online app. What piqued my interest in berberine for PCOS was a 2021 study by Italian researchers Rondinelli and co-workers, who found that a berberine phytosome extract had a very significant effect on biomarkers of PCOS. It was a small study of just 12 women with PCOS. Nevertheless, the findings are very promising. Berberine was found to be associated with a significant decrease in HOMA, a measure of insulin resistance, inflammatory markers including C-reactive protein and TNF-alpha, as well as triglycerides, testosterone, BMI, visceral adipose tissue, and fat mass. They also found that berberine increased sex hormone-binding globulin, which means less circulating free androgens. And now to the present study, which was published just a few weeks ago on the 21st of November 2023. The lead author is Dr. Francesco Di Piero, a biologist and pharmacologist from the Department of Immunology, Medicine and Surgery at the University of Insomnia in Italy. The study was designed and executed by Italian new product development and research company Valea Research. The second author is Dr. Sultana from the Department of Gynecology and Obstetrics at the Ayub Teaching Hospital in Pakistan. The other authors are from various university departments, labs, and hospitals in Pakistan, Italy, and the UK. Berberine is found in several plants, including Berberis vulgaris, common barberry, Indian barberry, golden seal, and Coptis chinensis. Berberine is a poorly absorbed natural alkaloid, widely used to treat diarrhoea and other digestive disorders and to lower cholesterol and hyperglycaemia. It has also been reported to reduce signs and symptoms of PCOS. Let's look at the study details. The study included 130 women with a diagnosis of PCOS and fertility issues due to menstrual and ovarian abnormalities. The study was a controlled, randomized, multicentric, and open-label clinical trial. The control group got the same standard of care, but no placebo pill. The intervention was Berberine phytosome given at 550 milligrams twice a day. This extract is manufactured by Indena in Italy. It is known as Berberis phytosome. Indena claims in an unpublished human pharmacokinetic study that the berberine has a 10-fold better bioavailability compared to common berberine chloride currently used in berberine supplements. The Italian company Pharmextra provided the product, which is called Sophie. The extract, Berberis phytosome, is standardized to contain 28 to 34% of berberine by HPLC, or about 180 milligrams per tablet. The study was conducted over 90 days, and the primary outcomes were changes to menstrual regularity, hormone levels, and ovarian morphology by ultrasound. All studies need to be defined by certain criteria for who's allowed to participate. In this study, participants needed to be between 18 and 45 years old and diagnosed with PCOS, according to the Rotterdam criteria. They could not suffer other serious hormonal, liver, metabolic, or kidney disorders. They could not be doing IVF, be pregnant, lactating, or menopausal, and they needed to have a reasonable level of anti-Mullerian hormone. This flow chart shows that 130 women were enrolled in the study and randomly allocated into two groups. 51 from the Berberine group and 55 women from the control group completed the study. All participants received the same standard of care, including dietary advice to reduce carbohydrates and exercise more. Adherence to the intervention was assessed by counting the number of returned Berberine tablets. Less than 10% was returned, suggesting good compliance. It is critical that researchers conduct a power analysis to gauge the number of participants needed to show statistical significance. Researchers first have to decide the expected effect size for the intervention, for example, a 25% reduction in symptoms or other outcome. In this case, the power analysis suggested that at least 106 participants were needed for the study. It should be standard practice to include a power analysis, but this is not always done or included in articles. The researchers also ensured that other variables were accounted for, including where the participants were recruited, family conditions, reasons for failure to conceive, and lastly, standard statistical methods were used and described in the article. It is also necessary to fully articulate what you intend to study. This is often divided into primary and secondary outcomes or endpoints. The three primary outcomes in this study were changes to menstrual regularity, hormone levels, and ovarian morphology. For the primary outcome number 1, the study found that berberine was associated with a resumption of regular menstruation in about 70% of women in the berberine group versus only 16% of women in the control group. This difference was highly significant with a p-value of less than 0.001. For primary outcome number 2, the study found little difference between the two groups in terms of changes to their hormonal profiles. It was noted, however, that free testosterone was reduced by 23% in the berberine group versus just 4% in the control group, although this was not significant. However, as a clinical measure of hormonal imbalance, acne was shown to be improved in 50% of women in the Berberine group compared to just 16% in the control group. And hirsutism was reduced by 14% versus 0% in the control group. For primary outcome number 3, Berberine supplementation was shown to significantly reduce polycystic and structural abnormalities in the ovaries from 90% to 27%, while in the control group, the reduction from baseline was only 96% to 73%. In terms of secondary outcomes, the anthropomorphic measurements, including weight, BMI, and waist circumference, did not differ significantly between the two groups. There were improvements in both groups, probably attributable to the standard care all women received. Secondary outcomes also included changes in free testosterone, LH, FSH, glycemic profiles, and insulin resistance. However, the metabolic and the hormonal profiles of the women in the two groups did not significantly differentiate at the end of the study. Secondary outcomes related to dyslipidemia found very little differences between the two groups. Surprisingly, triglycerides decreased more in the control group compared to the Berberine group. The fact that the majority of participants were normoglycemic and normolipidemic at baseline may explain this lack of effect on cholesterol and other lipids. Other secondary outcomes related to liver function, liver disease, and C-reactive protein were considered normal at baseline, and no significant changes were observed. The study also examined the impact on well-being and quality of life. After 90 days of supplementation, the Berberine group's well-being score increased significantly, with no significant increase observed in the control group. The emotional well-being scores of the two groups were very similar at baseline. After 90 days of supplementation, the Berberine group value rose to 34 points, with a p-value of less than 0.0001, which is highly significant. No significant increase was observed in the control group. In terms of positive body weight changes scored by the participants themselves, Berberine was associated with a significant increase in perceived body weight improvements. Baseline scores were very similar for the two groups. After 90 days of treatment, the scores for Berberine had increased significantly from baseline and was also significantly higher than the scores of the control group. No significant changes were observed in the control group. In terms of blood parameters, Berberine had no significant effects on red or white blood cells, platelets, or hemoglobin. Berberine phytosome was well tolerated, and no specific side effects were registered. Respectively, after 1, 2, and 8 years of trying, 3 women supplemented with Berberine phytosome became pregnant. So in summary, the intervention was the product called Sophie, containing Indina's Berberis phytosome extract. The dose was 550 milligrams twice daily for 90 days. Menstruation normalized in 70% of women. There was normalization of the ovarian anatomy in more than 60% of the women. Acne improved in 50% of the women. Hirsutism reduced in 14% of women. No difference in metabolic and hormonal profiles, and no specific side effects registered. And 3 women became pregnant. I think you will agree that Berberine phytosome is a promising new therapy for PCOS. It should be noted that the phytosome extract has a claimed 10-fold improvement in bioavailability compared to isolated berberine hydrochloride, thus providing an effective dose of 360 milligrams of bioavailable berberine per daily dose. The intervention used in this study was a product called Sophie. I encourage other manufacturers of related products, for example lysosome extracts, to also invest in clinical trials and demonstrate the bioavailability and clinical efficacy of their products. Thank you for watching. I hope you enjoyed this review and learned something about Berberine for PCOS. Please follow and like the Phytotherapy Desk Reference YouTube channel. You can also find us on all the other social media sites. Just look for the Phytotherapy Reference handle. If you like this content, please be sure to check out the Phytotherapy Desk Reference online web app. It is the most clinically relevant online resource for prescribers of herbal medicine, with detailed monographs of over 250 herbal medicines used by naturopath, herbalists, and functional doctors. It has a special section on standardized extracts, and you can search 1,400 herb-drug interactions or browse an index of 5,000 clinical studies and reviews. We are constantly adding new content. A free trial is available at phytotherapydeskreference.com. Thank you, and please subscribe.